What if I told you that a simple bedside practice, 7 to 10 minutes before sleep, can open a kind of inner seeing while you drift off, a quiet activation of the so-called third eye that many people only experience in fragments? What if that doorway was exactly where our ordinary sight and our sleep onset awareness meet, and that some streams of ancient tradition hint at methods to pass through it? According to certain Gnostic texts and later practitioners, there was a lineage of inner teaching, fragments preserved in writings like the Gospel of Mary among the Nag Hammadi discoveries, that pointed disciples toward techniques for perceiving what usually slips beneath the surface of waking vision. I don't present those texts as canonical proof. I only offer them as one thread among many that suggests human perception can be trained in subtle, often nocturnal ways. If the idea of testing this at home resonates, type the word visible in the comments now and settle in. This is a careful, practical path, not a promise. There's a reason this matters. In several alternative spiritual frameworks, especially certain Gnostic traditions, the world we take for granted is layered. Some forces operate precisely because we do not perceive them. Their invisibility is their leverage. In these narratives, they are sometimes called archons. Name and nature vary across authors, described as manipulative presences that influence thought patterns, drain attention, or obscure clarity by slipping into the margins of perception. Whether you take these descriptions as metaphors for psychological patterns, as spiritual beings, or as a mix of both, the practical claim is consistent. When something is not seen, it can go unchallenged. Visibility, then, is a form of resistance. Seeing what was hidden reduces its power to shape you unconsciously. How could this be possible? The answer lies not in secret supernatural wiring, but in the ordinary mechanics of perception and an overlooked moment we all pass through every night: hypnagogia, the borderland between waking and sleep. During the sleep onset, we experience vivid imagery, fleeting sounds, and a loosened grip from the brain's usual filtering. Our visual system is not off, it's in a different mode. Central, focused vision usually commands our attention during the day, while peripheral vision quietly monitors a wider, lower resolution field. That peripheral channel samples frequencies and motion we often ignore. The brain, by habit and evolutionary convenience, filters what we don't deem relevant. But that filter is more malleable than we think, and the threshold just before sleep is a moment when that malleability increases. Many practitioners report that softening the gaze and carrying a gentle awareness into hypnagogia lets previously unnoticed forms or distortions become visible. Imagine your visual system as a camera with two lenses, one for detail, one for context. The detailed lens focuses on faces, texts, and objects you name. The contextual lens, peripheral awareness, registers motion, tone, and low contrast anomalies. Most training methods that aim at inner sight ask you to cultivate that contextual lens, not by straining the eyes, but by relaxing them, allowing the outskirts of vision to do their job. Over repeated sessions, this relaxed register begins to inform the mind more readily, even as it slides into sleep. Practitioners describe a progression: initial flickers at the edges, then sustained impressions during hypnagogia, and sometimes the sense of a presence or shape that dissolves on closer inspection. Others find that the seeing feels more like an expanded sense of knowing, an inner recognition that the ordinary mind discounts. If you want to try a version of this adapted specifically to activate the third eye while sleeping, here is a bedside protocol many report as accessible and safe when practiced with caution. Read it all through before attempting it, and honor the safety guidelines that follow. Prepare your environment so it's dim and calm. Turn down bright lights. A single low lamp or a shaded warm bulb is sufficient. Avoid screens for at least 30 minutes before the practice if possible, since their light spectrum and narrative pull can interfere with sleep onset. Make your bed comfortable. Recline or sit in a slightly elevated position so you can maintain a gentle, unobstructed view of a neutral area, a wall, a ceiling corner, or an object at arm's distance that has little detail. The idea is to provide a soft, featureless visual field for the peripheral channels to register movement and low contrast shifts. Settle your body. You do not need elaborate postures. Lie on your back or recline with pillows under your head and knees so there is no residual physical strain. Keep your hands relaxed at your sides or on your abdomen. Breathe slowly and evenly. Bring attention to lengthening the exhale just enough to calm the nervous system. Avoid forcing breath or holding it. The breath is an anchor, not the object of the practice, but a way to soften the overall system. Now the eyes. Soften your gaze rather than close it tightly. Let the eyelids be relaxed. Do not clench them shut. Focus neither on a target nor on trying to see something specific. Instead, allow the eyes to unfocus slightly, as if you had been looking at a distant scene through fog. This is the soft gaze. It's not about straining to catch images, but about reducing the brain's habit of filtering everything into crisp, labeled objects. Keep this soft gaze for 7 to 10 minutes each night. The initial period to establish a pattern that many people report as effective is 7 to 10 consecutive nights. That timeline is anecdotal and varies widely. Some notice changes in a few nights, others need weeks. Use that window as a reasonable experimental baseline, not a guarantee. Crucially, carry a gentle intention, a short, quiet phrase that expresses what you're doing. It might be as simple as, "I open to quiet seeing," or "I remain open as I fall asleep." Intention isn't magical power. It's a cognitive note that reduces the mind's tendency to get lost in anxiety or tasking. Keep the tone neutral. Avoid combat imagery or force. The aim is permeability, not confrontation. As you feel sleep approach, allow the soft gaze and the relaxed attention to remain. Do not force wakeful observation. Hypnagogia will often present images, shapes, textures, or a sense of presence that can be more vivid than daytime peripheral flickers. If you notice sudden alarm, intense fear, or hallucinations that feel overwhelming, stop the practice and consult a professional. This method is not appropriate for anyone with a history of psychosis, schizophrenia, or severe sleep disorders without medical or psychiatric guidance. A few optional supports can help with the transition. Keep a small notebook or voice recorder within reach. If you wake in the night or morning from unusual imagery, jot down a few words before the material fades. The hypnagogic impressions dissolve quickly, and simple notes are sufficient to notice patterns over time. In the morning, do a brief grounding ritual. Breathe, drink water, and step outside into daylight briefly if possible. That helps separate the nocturnal perceptual experiments from your daytime routines and prevents lingering anxiety. Above all, practice kindness towards yourself. The intention is to expand perception gently, not to chase dramatic experiences. What might you see? Reports vary, and language is always inadequate to describe threshold phenomena. Many people speak of peripheral flashes, like a wave of static, a shimmer, or the sense of a shadow that moves against the grain of ordinary light. Others describe semi-transparent forms that lack the solidity of a person, but have edges and movement. They may be described as smoke-like, like heat-haze distortions, or like elongated shadows with thin, thread-like appendages. Some practitioners note points of attachment, subtle lines or cords that seem to link a person's field to an adjacent blur, though interpretations differ on whether these are literal connections, symbolic impressions, or purely psychosomatic experiences. The critical point is this: visibility often feels ephemeral at first. It arrives as a peripherally registered event, and often recedes when we try to scrutinize it with waking logic. That elusiveness is part of why training the hypnagogic window matters. It's a state where scrutiny softens and pattern recognition can shift. Let me offer 2 short vignettes to illustrate how this unfolds in everyday life. Maya, an office worker who began the bedtime soft gaze routine after reading about hypnagogic practices, noticed small changes within a week.
At first, she saw nothing dramatic, just faint flickers in the corner of her eyes as she drifted off. On the 10th night, she felt a presence at the edge of her bed. Not a face, but a vertical distortion like a heat mirage that pooled and then slid toward the doorway. It did not feel immediately hostile. When Maya calmly held her soft gaze and maintained a measured breath, the distortion unspooled and diminished. She experienced a curious lightening in the sense of heaviness she sometimes carried into sleep. Maya interpreted the event as a boundary undoing a drain she had accepted for months. She made no public claims and kept the practice private. Her priority was personal clarity, not proving anything to anyone. Eric, a younger man who volunteered in community outreach, practiced the protocol for 2 weeks. He reported waking once with a striking image, a dim cord-like filament that seemed to attach from a stranger in the corner of his vision to a cluster of shadow behind a bookshelf. The content was unsettling enough that Eric paused the daily practice and consulted a therapist when it stirred anxiety. After pausing, and with therapeutic support, he resumed slowly and kept a morning journal. Over time, he learned to distinguish between ordinary anxiety-driven images and the quieter, peripheral distortions he'd first noticed. He reframed the work as perceptual training rather than supernatural confrontation, and used the insights to set healthier boundaries in his waking life. These are anecdotal accounts, not proofs, and they reveal the typical progression: initial flickers, a rare vivid scene, and the need for careful integration. If you do begin to perceive something, what then? There are practical, ethical, and psychological considerations. Visibility should be used primarily as a means of self-protection and inner clarity, not as a tool for public accusation. In communities where people have different beliefs about such phenomena, pointing and naming can do more harm than good. Often the most effective response reported by practitioners is to withdraw attention calmly, strengthen personal boundaries, inner and practical, and seek support if the experience disturbs daily functioning. Visibility tends to diminish the leverage of what was hidden. Once a pattern is noticed, its psychological power often weakens. Many who practice say that simply acknowledging an edge of influence without dramatizing it reduces its capacity to dictate moods or behaviors. When we bring ancient sources into the conversation, it's essential to be precise about provenance and interpretation. Texts like the Gospel of Mary are part of a broader corpus discovered at Nag Hammadi and categorized by scholars as apocryphal and Gnostic. They do not sit within the canonical scriptures of most mainstream Christian traditions. They represent particular theological and spiritual currents from antiquity.
Some readers interpret them as preserving practical teachings, including, perhaps, exercises aimed at inner perception, while others regard them as symbolic or sectarian. Presenting these texts as one possible influence and not as undisputed historical instruction from canonical sources respects both the complexity of the historical record and the diversity of modern faith communities. If you approach these writings as inspiration rather than proof, they can be helpful guides to alternative ways of attending to perception without necessitating doctrinal adoption. There are also social implications to consider. If you begin to notice patterns of influence in social settings, a person who seems repeatedly drained after encounters, a space that feels heavy, visibility can prompt compassionate action, offering support, setting clearer boundaries, or encouraging someone to seek help. It is not, however, a license to assume moral superiority or to publicly label others as manipulated. The ethical stance that aligns with this work is witness. Observe what you notice, protect your own field, and act with humility and care. Many have found that the knowledge of an invisible influence is most useful when it leads to practical steps like better sleep hygiene, clearer emotional boundaries, and professional help when needed. A few strong cautions. Do not attempt this practice if you have a history of psychosis, schizophrenia, or other severe psychiatric diagnoses without discussing it with a qualified mental health professional. If the practice increases anxiety, triggers panic, or produces persistent nightmares or daytime disruption, stop and consult a clinician. This protocol is about gentle perceptional training, not about inducing extreme altered states. Do not use it to attempt confrontations, exorcisms, or theatrical claims of superiority over other people. Do not try it if you are sleep-deprived to the point of danger. For example, if you need to drive immediately after practicing and are likely to be exhausted or disoriented. Be mindful of your safety and the safety of others. For those who proceed, keep a simple, practical routine. Nightly, 7 to 10 minutes of soft gaze before sleep for an initial block of 7 to 10 days is a reasonable experiment. During the session, maintain relaxed breathing, a neutral intention, and a dim environment. Keep a notebook or recorder nearby for morning notes. Ground each morning with water, sunlight, and a small ritual that distinguishes nocturnal practice from daytime life. If the work yields disturbing content, pause and seek guidance. If it yields clarity and a sense of empowerment, continue responsibly and privately, integrating the insights into better self-care and boundaries. Finally, why pursue this at all? The core argument here is not mystical conquest, but practical emancipation. Many spiritual currents teach that knowledge reduces manipulation. In this context, expanding your perceptual range, learning to notice the subtle, peripheral cues you normally discount, is a way to reclaim attention and agency. Whether you interpret the phenomena as archons, psychological patterns, energetic distortions, or hypnagogic imagery is less important than the lived result. People who learn to notice what once passed unnoticed report less confusion, fewer unexplained moods, and a stronger ability to choose their responses. Visibility, in that sense, becomes a tool for inner freedom rather than power over others. Remember that the claims about Jesus or the Gospel of Mary are offered here as elements of a contested interpretive tradition, not as canonical endorsements. Some ancient fragments and later practitioners suggest that early inner circles cultivated practices to expand perception. Many scholars and believers disagree about what those texts mean or whether they reflect the historical Jesus' teachings. Approach these references with curiosity and critical thinking. If you choose to try this practice, begin gently. Commit to the short nightly routine for a week or two, keep notes, and prioritize your mental and physical safety. If what emerges is unsettling or disruptive, stop and consult a professional. If what emerges is a renewed sense of clarity and reduced influence from what once felt unseen, then you have discovered a pragmatic way to make the margins of perception part of your waking wisdom. Visibility erodes manipulation. Attention transforms what once hid into what you can witness and choose. If this message landed for you, leave the word visible in the comments. That single keyword is a small practice of intention and a way to connect with others exploring the same edge. If you want guided sessions or a deeper dive into safe hypnagogic practices, subscribe so you don't miss what's coming next. Take care, be gentle with yourself, and remember, the border between waking and sleep is not a place to conquer, but a doorway to practice.